All right, so today I will be discussing the neurological body system, and more focused, I'm going to be discussing how we see changes in the elderly population when it comes to their neurological body system. So in this video, I'm going to be discussing, how or the signs and symptoms of the neurological changes. I'm going to be discussing the pathophysiology of why those changes occur. I'm also going to be discussing how we can educate our to ensure that they are receiving the adequate care that they deserve, and also being sure that they are taking care of themselves at home. And at the end of the video, I'm going to have a little bit of fun facts for us so we can go ahead and see how much we can learn about the neurological body system in the elderly population. It is very important for us to distinguish the difference between neurological and neurocognition. Both of these terms go hand in hand with each other. However, they are two completely different things, and we're going to distinguish what those both mean right now. Perhaps the most important distinguishing factor is that neurological can pertain to the central nervous system as well as the peripheral nervous system, and this deals with things like neuropathy in your toes or tingling sensation in your fingers. It can be any of those kind of things. We see this a lot in diabetics. We see this a lot in the elderly population, the loss of sensation in their feet or tremors in their hands. So that kind of stuff is dealing with the neurological side of things. So when we talk about neurocognitive, we're dealing mostly with inside the brain itself. So this is going to be entirely the central nervous system and disregarding the peripheral nervous system. The most common things that are talked about when discussing neurocognitive degeneration with the elderly population is, of course, going to be Alzheimer's and dementia. Again, those deal with your emotions and your memory and your thought process, which is all neurocognition. So our brains are an incredibly complex system of nerve endings, electrical signals, and matter that allows us to carry out life every day as we know it. Sometimes we take for granted just how well our brains work, and I know a lot of the elderly population, we see as they age that the nerve endings start to break down and the brain doesn't function as well as it once used to. And these are just some of the changes that we see in the elderly population. Short-term memory loss isn't necessarily a quote-unquote normal part of aging. However, it is very common with the elderly population. I think we can all relate to somebody that we know who has had, whether it be a very minor or a very severe case of Alzheimer's or dementia, and have been unable to retain their short-term memory. So I'll get into the pathophysiology of this second point a few slides later, but we also see weakness and paralysis as the CNS starts to degrade in elderly patients. This is due to the diminished amount of nerves in the brain, which of course is going to be weaker signals sent out to the peripheral nervous system, which ultimately can result in weakness and paralysis of extremities. I'm sure that we all have heard the phrase, "I'm not as good as I once was," or "I'm not young and spry like I used to be anymore." And while we used to just laugh that off, we now know that that is a real thing. As we get older, our reflexes and our sensations start to slow down with us, and that's again because of the degeneration of the nerves in the brain. We're not able to perform tasks like we used to. We can't react like we used to. So, this is a very common part of aging, is people not being able to retain short-term memory as I used to be able to. People might feel like they are weaker. Again, muscle atrophy, weakness and paralysis coming from the CNS. And again, the slowed reflexes and sensations. We aren't able to perform at the level that we used to when we were in our 20s or 30s. So now I'm going to discuss what kind of changes that we see happening in the peripheral nervous system of older adults. So we all know that a majority of our patients at the hospital are always put on a fall risk, and we wonder why. Like, they're walking around just fine. Well, the reason is because a majority of elderly patients are put on a fall risk because they lose the sensation, and it puts them at a higher risk for falls. Proprioception is when we are able to distinguish where our extremities are in relation to our body. So you put your hand behind your back, you know that your hand is behind your back because of proprioception. Well, when elderly patients start losing their PNS and losing their CNS, both of these together combine for a lessened sense of proprioception. Where your extremities are, like your legs, you can understand why we see so many falls that occur in the population. It's because this lessened sense of proprioception is enabling them to have greater falls, to have more falls, because again, they simply don't, their brain does not understand where their legs actually are. Neuropathy is an incredibly painful thing. I have personally seen this within my family myself, is that the older adults in my family just have a constant pain, whether it be an aching pain or a stabbing pain, just on a random part of their body where they've had nerve damage in the past, or a new spot has come up. And that's all because those nerves are starting to degrade away and causing them immense pain for no reason. Now that we were able to discuss both the changes in the central nervous system as well as the peripheral nervous system, I hope that we can get aware of just how important these changes are, how much these actually can affect our patients. The tremors, the neuropathy, the short-term memory loss. These are life-changing factors, and we need to be made aware of just how important they are so we can better help our patients get these under control. So we all know just how important assessment is, regardless of our patient's age range, but there are certain factors and accommodations that we need to make when assessing our elderly patients so we as nurses and doctors can better understand the state that our patients are in and how we can better take care of them. Assessing our patient's level of conscience is crucial. A patient's LOC can be a great initial piece of information that can rule out certain issues and highlight others. In a neurological assessment, we assess the patient's peripheral extremity strength to ensure that there is no neurological deficits, for example, a stroke. Assessing a patient's PERLA is also a very important procedure when performing a neuro assessment on a patient. As far as accommodations to the assessment for the elderly go, we need to focus on nerve damage. Observing for the loss of sensation in fingertips, palms, soles of the feet is necessary. This can be done by the family by taking an item such as a paperclip and lightly grazing the site unquestioned, and having the patient stay whether they can feel it or not. By performing this simple test, patients can be vigilant in maintaining their health. Another leg of an assessment that needs to be made with the aging population is the risk for fall scale. So as I discussed earlier, the elderly population is at a much higher risk for falls due to their loss of proprioception. So these can cause hazardous falls with the older adults. So it is imperative as us as nurses to assess our patients' risk for falls as we carry out our normal assessment on them. So one of the biggest factors of these neurological changes as we age is our dendrites are actually withering away. Studies have shown that our dendrites wither away over time, which leads, of course, to diminished amount of nerves throughout our brain. So again, that's going to lead to the weakness and paralysis and your short-term memory loss. It's because these dendrites are actually just kind of fading away inside our brains. Our meninges are the three layers around the brain that kind of protect it. But actually, as we age, we have a decreased adherence of the dura mater. We have increased fibrosis, and also we have thickening of the meninges. All of these lead to higher susceptibility of injuries when experiencing trauma. So that's why it's such a big deal when elderly patients fall and hit their head. It's because all of these meninges are out of whack. Just like all of the other body systems, we must properly care for our nervous system. Our bodies are a bunch of different factories synergistically working together to allow us to function. Most of these education points can be carried over to other body systems as well, but nevertheless, here are some ways to properly care for your nervous system. First things first, stay vigilant with your health. It is your body and your nervous system. You need to notify your PCP of any changes. Perform self-assessments, routine checkups, and etc. Just be vigilant with your health to ensure that nothing bad is happening. I know I sound like a broken record when I say this, but maintain a healthy diet. The reason that you always hear maintain a healthy diet so much is because it is so crucial to the health of our bodies. We need to put into our bodies what we expect out of our bodies. So if you put healthy things into your body's going to appreciate that, and it's going to keep you healthier for longer. So just maintain a healthy diet and things will hopefully look up. Just like the muscles throughout your body, your brain needs exercise as well. Playing certain games, performing certain brain teasers, crossword puzzles, word searches, or anything like that for a short time or a short time period a day can help your brain keep those nerve endings alive, which allows you to retain your short-term memory and just keep your neurological health up to par. The last 2 points that I have are to stop smoking and drinking if you can, and obtain adequate sleep. We've all heard the phrase, "I can't function properly without my sleep," but do we realize just how true that is? Obtaining an adequate amount of sleep allows our bodies to fully reset and prepare for the next day. And of course, smoking and drinking isn't good for any of our body systems and should be kept to a minimum, if not at all. The second one, as you can see right there, is that there are more nerves in our brains than we have stars in the Milky Way galaxy. That to me is just incredible, and it lets me realize just how special our brains are. And the last fact that I put on here is a newborn baby loses about half of its nerves before it's even born. So if we have 100 billion nerves in our brains now, imagine how many we have when we're first developing inside the womb. Alright guys, that concludes my presentation. I just want to thank you guys very much for watching, and I hope that I provide some piece of information that you were not aware of. Just remember that the aging population becomes very susceptible to these changes, and we as nurses need to be aware of those changes and do everything in our power to ensure that they are comfortable and can live a long, happy life. Thank you guys very much.